Hi, everyone. I'm John Kenlon, Senior Vice President at Ensemble IQ and publisher of Drugstore News. I'm with Sarah Mastroraco, VP and General Manager of Instacart Health. Hey, Sarah, how are you?
Hi, great. How are you?
All right. Thanks for being here. Let's get right into it. Instacart Health was formed just a little over a year ago. Can you tell the audience a little bit about what Instacart Health is?
Absolutely. And thank you for having me. I'm excited to be on the show. Appreciate your interest in Instacart Health and obviously your commitment to health overall. I lead Instacart Health, and that's an initiative under Instacart. Again, as you mentioned, we launched a year ago. Our goal is to address really three pillars across health: nutrition security, inspiring healthy choices, and kind of combining those two to scale food as medicine programs. And I'm sure we'll talk a little bit more about food as medicine. And we're really partnering closely with the healthcare industry. But before I jump in, I think it's important to talk about Instacart and why we believe we have a lot to bring to the table to the healthcare industry. We're the leading grocery technology company in North America. And what that means and our mission, we're mission driven. We're on a mission to create a world where everyone has access to food they love and more time to enjoy it together. And then from a healthcare space, we really want Instacart Health wants people to have access to food to help them thrive and tools to build healthier habits. So we have 1,400 retail partners on our platform across 80,000 stores. We cover 95% of households in the US, over 95% of households, and that includes 93% of residents living in food deserts. So every day, millions of people are turning to us to get groceries, and we can support so much more too. So that really is what inspired us to create Instacart Health. We're at the intersection of food and families, right? As a result, we can really have an impact on health. So we formed a year ago and have been forming partnerships that I'm excited to talk to you about today to really help be the infrastructure for food as medicine programs, help everybody from payers, providers, nonprofits, and employers scale both education and inspiration, but also subsidies and leveraging tools to make sure that people really can use nutrition to improve their health and honestly lower the cost of care, we believe, in the long run.
I'm going to get to this in a moment, but particularly interested in what you said about food deserts and the ability for Instacart to play a huge role. You know, food equity, health equity is a huge issue. And if there's no store around, and if someone can't get there, how do they resolve that problem? So Instacart represents a terrific solution.
And I should have said that we also accept EBT SNAP across 10,000 locations, all 50 states and DC. And that's hugely important too. A big part of Instacart Health is leveraging existing payment sources to make people's wallets stretch further.
Absolutely. So going back to a term you mentioned, food as medicine. We hear about it all the time, and evidently Instacart agrees that it's very important. You recently announced a program with Mount Sinai Health Systems. It's just an example of some of the things you do, and that's providing fresh groceries, pantry must-haves, some household essentials to patients who have recently experienced a medical event. So tell us a little bit about that collaboration, and then your view of what the health ecosystem is, because we hear an awful lot about that.
Yeah, I think that's great. I might start there and then go to Mount Sinai and that's relevant, but I love that question. I mean, as we came to healthcare, it was honestly a steep learning curve for me. I know grocery quite well, and I was learning healthcare and how we fit in, and it really is a broad ecosystem, right? Thousands of companies, billions of dollars, trillions of dollars going into this ecosystem, and it is to help sick people, but there's a wellness side too. And you mentioned social determinants of health and health equity. And we really think of all of this as this ecosystem. And what we wanted to say is, how can Instacart play a role? What's our role? Our role is not to provide healthcare advice, right? We're not the provider. And we are very explicit about that. But what we are great at is technology and infrastructure and being a marketplace for retailers. We're a retail enablement company. How can we be a healthcare enablement company? And I think Mount Sinai is a great example of that. So Mount Sinai Health Systems has a solutions or health plan that supports employer and union clients. And they approached us and said, we know that post-discharge is a super sensitive time for everyone, right? If you've had a surgery or if you've had a baby, right? How can we support members of this plan? And to do that, they're giving $110 stipend through our technology called Fresh Funds. So Fresh Funds is a private credit system on Instacart that the funder is able to choose exactly what those funds are used for. Mount Sinai chose nutritious foods, some supplies, baby care, for example, from in a postpartum situation. So a really easy way that we were able to work with them for the advice and the occasion, almost the use case, right, for this. And then Instacart can easily provide stipends that work and a customized storefront. So if imagine I'm a new mom, which I'm not a new mom, but I have two, and I've been in that post-discharge situation, I can get a stipend. It's a reduction of stress. So it's reducing my stress from having to get to the grocery store, for eating healthy, for getting diapers. So we're really excited about that type of use case in a post-discharge situation. But then would love to share a few more examples of that. In the Medicaid space, we announced a partnership with Kaiser Permanente, and we're getting very specialized there. We're doing an over 1,000-person study with Medi-Cal, so Medicaid patients with diabetes or at risk of diabetes, and we are giving them a program with a very specific stipend, again, with our Fresh Funds technology that has diabetic-friendly foods. And Instacart is not the expert there. We worked with Kaiser and Tufts University Nutrition Science School to develop an approved product list for these members. So if members agree to enroll in the program, they're getting $100 a month for 6 months. They're also getting 4 completely waived deliveries. So they could choose to spend more or less, but that $100 that they're getting only works for foods that experts have decided we think would be great interventions or encouraging foods. And that includes fresh and frozen produce. It includes plain yogurt. It includes spices and healthy oils and nuts and seeds and legumes. So it's a way that, again, Instacart's being the infrastructure for that program. Kaiser built a healthy storefront, a virtual storefront on Instacart, so that anyone can come and kind of have a cheat sheet of like, hey, here's a healthy view into Instacart. And I know these items are items that Kaiser has approved for me. Makes it really easy and stress-free to make good decisions at the grocery store. The $100 gives them that extra nudge. And really peace of mind that they're not wasting money to try new things, right? These are new items. And the great part about Instacart is all in the same transaction, they can use their SNAP dollars and their own funds. So I am a huge proponent of like taking that one trip away. Like if someone has to go to the grocery store to get something else, we haven't saved them any time, right? And we haven't saved them the cost of transportation. But if my $100 a month, let's say I had $50, I want to split it up. We give that member and that participant the dignity of choice to shop from the store they want, when they want, add their own funds or not. And we're excited and bullish about this program when we're sending recipes as well, and that virtual storefronts and reminding people. So another great use case for a Medicaid, right? In a Medicaid case, and we're excited to track those results of engagement. And Kaiser will be tracking, the health of the patient as well. Third use case is in the Medicare space. We're really excited to announce our partnership with Alignment Healthcare, so a leading regional Medicare Advantage plan. We've co-sponsored a technology-first plan for their members to use their $50 or $100 quarterly grocery benefit on Instacart, and that we've given that member annual membership to Instacart Plus. So they're automatically getting waived delivery fees and discounts on service fees and much more. So we're excited because Alignment has done a lot of work in the health equity space and research, and they know that transportation and access to groceries are some of the top stressors that seniors face today. So grocery delivery can actually be a huge opportunity. And we found this during COVID. COVID on Instacart, we grew exponentially every day and we're able to keep up with that demand. And we're very proud of that and learned a lot. We established a senior care line during that time. And that senior care line gets thousands of calls a week. We're so excited to help seniors get more comfortable and familiar with our technology. If they have questions, we're there to order it. And that's a big part of what Alignment and Instacart really were able to come together and say, hey, let's tell more people about the senior care line. Let's get them comfortable with technology. And then all of a sudden in your pocket or on your desktop, you have access to 10 or 20 stores within your area that you wouldn't have been able to drive to yourself, that has a better selection and name brands that you trust. So we are going to make sure all of that grocery benefit money, our goal today is to make sure it can work on Instacart. With Alignment, we're partnering directly with them, but we announced our partnership with Income too. And there's so much money out there in the Medicare Advantage space in these card programs, and they haven't traditionally worked online. So that's another way that we're making sure that people can spend those alternative funds that they're getting in a way that like they're able to access the right stores and able to really spend all their benefits. So pause there. Have any questions on that? But I'm happy to answer. But really excited about all those 3 proof points in the employer, Medicaid, and Medicare space on how Instacart, kind of tying it back to the ecosystem, our role in that ecosystem is infrastructure for others who have these great ideas for programs. Instacart can scale them overnight to households. We're already massive. We have this infrastructure to build it, and we're here to take advice and kind of build the technology platform online for them.
What struck me as you were talking was the importance of co-opetition or collaboration and or partnership, because healthcare is a very complex issue. And no one company, not Instacart, not United Healthcare, not CVS, not any big hospital system. Nobody has the single answer. And I like the way that you're involving so many different entities to provide a solution.
Thank you.
I suppose that's the path. That's the path forward.
We really wanted to come to healthcare humbly and say, we have this great product. We're not a disruptor. We're an enabler. We try to approach retail that way too. Like retailers, our drugstore partners are our partners. How do we drive incremental growth for you? How do we help engage and drive customers so that they, are loyal to your brand? You're driving new customers and trials. So we think of healthcare as a new channel for Instacart to acquire new members and business for our retail partners too.
I love that. We're not a disruptor. We're an enabler. No, that's great. Okay, so switching gears just a little bit here. Talk about you touched on it, but talk about the suite of digital provider tools that you're utilizing to improve patient care.
When we talk to a provider or a payer, or really a nonprofit, and they want to use our technology, we kind of think about it in 2 ways. How can we enable payment? Or is it your own money? Is it SNAP dollars? Is it extra money through fresh funds? Great. Let's do that together and develop that program. And then how do we have these, once you have the groceries or once you know how to order, how do we make these healthy choices easier? Really excited about leaning in here from our virtual storefronts or something that's great. And we can share some of those links with you that have been, Mount Sinai has publicly shared, and Kaiser KP and Rich study has shared those virtual storefronts. And it's just a window into Instacart. It's like a friendly, imagine like an end cap, but it's a 20,000 item end cap, right? The great link that anybody
choose from.
Yes, the link that's like a safe space of I don't have to like kind of sift through it. Kaiser recommends these items, right? Or like Mount Sinai has recommended, and I know that my payment works on these items, and it'll take what could be a 3-hour process down to 5 to 10 minutes, right? So that's one that like a really prime example that is really resonating in the provider space and the payer space of making healthy choices easier. But on top of that, it's all our recipes. We can make any recipe on the internet shoppable with our widget. So we're using those today too. And shopping lists. You or I, so I don't know if you knew it today, John, but you can go online and create a list and share it with somebody. So I could go create a list and hey, here's my healthy recommendations for the week. And that gets done quite a bit. Nutrition coaching is a great partner of Instacart. We don't provide coaching. We are a tool for coaches, right? To make healthy advice actionable. We always say that, if you've ever been to the doctor and really for any advice, sometimes it's yes, and you understand, but it might as soon as you walk out the door, forget it. Or there's a pamphlet that they've given you for advice, but it doesn't recommend specific products and it stays in your car and you lose it. So how about giving a QR code that is that shoppable advice, making it very actionable and easy. And that's going to help. Easy to use. It's shoppable information that can take you right to the store that you trust. And in 2 hours or less, if you want, get it delivered.
So in essence, I mean, you mentioned recommended items. You mentioned making healthy choices easier in quotes. And then we are a tool for coaches. So really, this is very educationally driven.
Yeah, absolutely. I think so. That middle pillar of ours is educate and inspire. Combined, it's all food is medicine, right? We want to empower people to make healthy choices that sustain. And we've done a lot of work with No Kid Hungry, and we continue to work with them. And some early research showed just subsidizing delivery and letting families use their SNAP dollars. We solved the time and transportation, right? That makes sense. But also stress. We reduced stress from the stigma of using government assistance, and also from budgeting, stretching your budget. And people don't think of online grocery that way, but many people that I talk to say, you know what, I actually spend less when I shop on Instacart because I'm able to budget and my kids aren't pulling things off the shelf. So really that planning feature and just having a running cart that you can put stuff back. No one puts stuff back at like in the grocery store, right? Like when you're at that conveyor belt, there's like, oh, how did I spend $200, right? It's like, oh, I'm over budget. Instacart is really easy. You shop the best stores, you can look, stores that you trust and you'll have low prices or look at what things are on sale. So that we have all these tools like virtual storefronts and recipes, but I also just want to highlight that online shopping really is a great planning tool to have people stick to a diet and a budget that they're interested in.
I totally get that. And you're removing obstacles. When someone can't get to care, they can't get to the store for that, pharmacy for that vaccination or that visit, then guess what? They don't get the care. So you have to find a way to get that either to them or bring them to it. And you're doing that on the food as medicine side. So last question, look into your crystal ball. 5 years from now, what is healthcare look like? How will it have changed and how will it have evolved?
It's a great question. And when I think about healthcare, I think like I'm thinking about food all day and nutrition. And so from that lens, I really see us more and more reaching a tipping point here on talking about food and prescribing food first. And we are working very closely with universities and nonprofits like Stanford and UCSF, University of Kentucky and University of Buffalo on research, especially the AHA and Rockefeller. We're doing some infrastructure for a lot of research. And I believe that we'll be able to prove and launch kind of food formularies. For example, in the Kaiser study, is that the effective formulary if you are on Medicaid with diabetes? Is it this $100 stipend every 6 months, right? So we're really working across all different use cases, from children's nutrition, from cancer survivorship, right? In kind of any scenario, can we do that infrastructure thing that we can prove these food formularies and they do become covered benefits? And it doesn't have to be the exact same for every person. It could be just delivery. It could be a small stipend. It could be for only produce or like diabetic friendly items. So rambling a bit there, and I do believe in the future there'll be, the research will show that prescribing food, and it will be different for different reasons, should be a covered benefit that we can both improve health outcomes and lower the cost of care. And, that's what healthcare is all about, right? So I think having that lens, and I do just think hopefully all this work in nutrition and getting access can be a huge health equity play, right? How do we reach underserved communities regardless? And we're really excited. Like, I guess one example I'll leave you with that I'm very excited about is the mayor of Columbia, South Carolina is sponsoring delivery for food deserts. And I always tell people, sometimes it takes, as I'm sure you know, John, it can take 3 years to set up a store, to build a store, get permits, right? So let's bring, if they're sponsoring Instacart Plus membership and a free delivery like a month for their residents to able to get access to fresh groceries where they would never have had an option if they didn't have transportation. So really excited about that use case too. I really do think that is part of the health ecosystem and just creative ways that we are working public, private to make things happen quicker and help people first, but at the same time, learn and see how we can scale those items. How effective are they?
I love that. I especially love what you're doing. Really is we're all familiar with consumer market segments, right? But this is really a patient market segment, whether it's a cancer patient, as you mentioned, or it could be a diabetic. It could be someone who's young or someone who's old. So let's segment them and get them on the right food formulary that you talked about. It's brilliant. Thank you so much.
No, thanks. It was so great to talk to you. Thanks for your interest.
Yeah, well, let's do it again because I'm sure there's going to be more to this story, Sarah.
Absolutely. I would love to stay in touch. And again, thanks for having me.
Excellent. All right, we'll do it again. Thanks, everybody.
Thank you.